So when you're talking about falls, one type of intervention that used to be used very frequently, which is now used as infrequently as possible, is the use of restraints in healthcare facilities. There's physical restraints, which are posy vests, wrist restraints, mitts. If you look on the picture, the illustration on the slide, this is the top picture is a mitt restraint. It's actually you put your whole hand in and tie it around the wrist so the person can't grab on to IV or other type of measures that you have set up for the patient's caring. And another one right below that is the picture of a person sliding through side rails. So 4 side rails up on either side of a patient is considered a physical restraint. And it's not allowed unless you have a doctor's order saying that they want to have all 4 side rails up, because more injuries occur from that, from having that kind of restraint than from not having that kind of restraint. And then chemical restraints are drugs that are used to control a person's behavior that are not in the person's normal medication regimen. So adverse health consequences occur from the use of restraints, both chemical and physical. It increases the risk of serious injury from a fall, increases the chance of skin breakdown, contractions, incontinence, depression, anxiety, delirium, and death. And it leads to these sentinel events. That sentinel events are those that cause serious harm or lead to death. So the standard of care in long-term facilities is to provide safe care without the use of restraints. So you'll find in the nursing home, I'd be surprised if you find anybody, even very confused patients, even very unsteady patients, who are physically restrained. They use bed and chair alarms. They put pads down on the floor, mats right next to the bed, and keep the bed in very low positions so if the person rolls onto the floor, they won't be injured. So because of all these accidents and injuries and deaths that did occur from when restraints were used frequently, the standard of care is not to use them at all in long-term care facilities. In acute care facilities, restraints should only be used as a last resort, and it should be used with the least restrictive restraint possible. So another safety consideration is that of fire prevention. 85% of fires occur at home. Common causes of fire: smoking in bed, kitchen fires, candles, faulty wiring, unsafe electrical equipment, electrical heaters. All of these things we need as nurses to make sure that our patients are aware of the hazards and prevention awareness. So we want to encourage patients to have a plan for escaping if a fire does happen at home. Make sure they have smoke detectors that are operating well. For the fires that do occur in facilities at hospitals or nursing homes or clinics, we want to make sure we know how to react quickly. So the acronym RACE, which is rescue, removing anyone in the immediate area, and then A is for activate, the fire alarm, confine, close the doors and windows, and evacuate, remove patients and others in the facility, is an important thing to remember, as well as you should know how to use a fire extinguisher. It shows you right there. You pull the pin and aim at the base of the fire, squeeze the handle, and sweep side to side. So you want to make sure your health facilities have smoke compartments to prevent the spread of smoke and fire. And you need to know your facility's evacuation plan, the code phrase for fire. It might be Code Red or Mr. Red. You want to know what the location of the fire alarms and fire extinguishers are, how to shut off the oxygen and other equipment, and how and when to fight a small fire. So all of these things, when you go to your nursing home next week, you want to make sure that you look for these things. I'm going to be asking your instructors to make sure that you go over this in lab and clinical this week, and also your first week at the facility. So poisoning is another risk factor of safety that is a major consideration for nurses. Accidental ingestion of medications causes 300 children to be treated daily in U.S. emergency rooms. This is a result of unsafe storage at home, poor supervision, multi-generational families, so little children are getting into your grandparents' medication, presence of multiple pharmaceuticals. A lot of people are on many medications and have things left over which they don't need to still have in their home. Carbon monoxide poisoning is the third leading cause of death from toxicity. It can lead to severe organ damage and death. Homes and workplaces should have carbon monoxide detectors. There's a lot of developmental risk factors for poisoning. Young children can easily get into household chemicals if it's not properly child-proofed. Preschoolers often end up with lead poisoning if there's old paint chips in the house that have lead. Children should be tested for lead poisoning. Inhalants and suicide attempts from older children and adolescents, and older adults who are confused and forgetful can easily end up poisoning themselves by accident. And a common problem these days, which we hear a lot about on the news, is poisoning from overdose, from either over-the-counter medications or illegal medications, or opioid drug use from over prescription, from extra meds being sold and used improperly. And as we know, Narcan is becoming more available to families, patients, and healthcare providers. Other things we're going to want to be asking our patients about are what household products they use, any pesticides on the yard, indoor and outdoor plants, and metals such as lead and mercury, which might be in their environment. We want to make sure our patients have the education and awareness of these hazards. So it is the nurse's job to promote a culture of safety in the workplace, in the hospitals and nursing homes and clinics that we will be working in. The Joint Commission has set up a set of national patient safety goals, which help us create this culture of safety. It really stresses patient identification. We want to make sure before we do any kind of treatment or give a patient any kind of medication that we have two forms of identification. And that's generally the person's name and birth date. We want to improve staff communication. We want to use medication safely. So we're going to be learning a lot about how to safely administer and draw up medications to give to patients. Make sure we use alarms safely, that we respond to alarms quickly, and we don't develop what's called alarm fatigue. We make sure we follow infection prevention methods, and we'll be talking a lot about that next week. And identify the patient safety risks, which we've been talking about through this lecture. So if there is an accident or a safety problem at work and there's some event to report, we want to make sure we report it, because most of the accidents and injuries that happen are preventable, but they're also mostly system problems. So if a person creates, if you have a situation in which you cause an accident or harm to somebody, it's really important to fill out one of these safety event reports so that they could be reviewed and the accidents could be prevented in the future. Finally, for this chapter, I'd like to talk about some safety hazards to healthcare workers. Back injuries are very common. Up to 52% nurses report chronic back pain. The musculoskeletal injuries most often affect shoulders and back, but I've seen them affect people's wrists, their legs, their feet. So you want to make sure that whenever you're moving a patient, that you use assistive equipment such as lifts. This pictures of this, in the bottom right-hand corner of the slide, a picture of a lift being used. So for any patient handling activities, you want to make sure you use these devices to help save your injury to your backs. Needle stick injuries are another common problem. Even with the use of needleless IV systems and safe medical devices, up to 26% nurses still report having had at least one injury from a sharp contaminated with a patient's blood. So these injuries from needles and other sharps put healthcare workers, particularly nurses and housekeepers, at risk. You want to make sure whenever you're using a needle that you take precautions. As soon as it's done, you immediately put any kind of sharp right into one of these containers that sharps go into. That way you'll be decreasing the chance of getting stuck or having somebody else stuck from equipment that you've used. Radiation injuries, you want to make sure that you keep time, distance, and shielding to limit radiation exposure from diagnostic procedures. And finally, workplace injuries and violence are common, and it's a systemic problem because in hospitals and nursing homes, you'll often have patients or families who are very upset, they're in pain, they're very uncomfortable. There's a lot of bureaucratic red tape and delays, and all of this can lead to violent outbursts by families and patients. So you want to protect yourself. You want to de-escalate tensions, step away from unsafe situations, get help, call security. Nearly a half of the nurses reported have said they've been threatened, verbally or physically abused. So you don't want to be in that number, and you want to make sure you're protecting yourself in your interactions with patients and with families. If you have any questions you would like to ask or comments to share on the safety unit, please use the drop box on the main page of the Nursing Skills Fall 2017 eClass site to do this. Thank you.